I mean, 10 years is a long time. It's almost unbelievable to me in a lot of ways that it's been this long. On the other hand, it does feel like it's been 10 years. But I think we've really started to hit our stride, especially in the last couple of years. Everything starts to come together. I think that when you have a vision and you start with nothing, I mean, basically Living Free was started with an idea and me. And I was able to kind of marshal resources. I had a lot of very good people helping me. With good vision, with lots of different resources and talent, and here we are today, from basically nothing to 4 houses, 6 office suites. We have the cafe, as you know about, and we'll be opening the Living Free Gym, which is another therapeutic workplace. And then the gym should open about October 1. So we're going from the point of putting people through treatment, giving them safe housing, getting them jobs in a safe environment where they're learning skills, where we can make accommodations for all the things that go with early recovery. Lots of doctor's appointments, court appointments, sometimes just a meltdown, just difficulty dealing with life on life's terms. We were able to procure grant monies from the opioid settlement money. And how did we do that? Well, I've always recognized that frontier, not rural, we're rural here in Pahrump. I'm talking frontier, I'm talking Tonopah, Round Mountain, Beatty, Goldfield, etc. Those areas, there is nothing there for them in the way of treatment, not really, and certainly not transitional housing, and just the distance to just a regular doctor or a psychiatrist. So I wrote a grant proposal, and we won the money. And so what we're able to do is we are dedicating 8 beds to only Frontier Nevadans. And that will be 3 men's beds, 3 women's beds, and 2 women and children beds. And we will have the funds and the money to pay the staff to be able to go to those remote areas, go get people from, say, the Tonopah jail, or get them from Round Mountain or Goldfield or whatever, and bring them back and get them the services that they need, the whole entire wraparound, the doctor, the psychiatrist, the outpatient treatment, the transitional housing, the job skills, etc. Get them whole again, and then be able to return them to their communities so that they can become ambassadors of recovery in their communities, and maybe they can drive a stake in the ground there to help address the problem where it hasn't been addressed before. Speakers that we had today, we had Assemblyman Hafen, we had Sheriff McGill, we had we had Mark Kampf, we had former Commissioner Mr. Koenig. We had a couple of people on our board of directors, Tom Metcher and Ryan Muccio, and we had a few people from the community who wanted to speak.
This is a proclamation recognizing all of the hard work that you have done here in this community with such passion and drive.
I just wanted to say the services that are being provided here are incredible. Our community does not have nearly enough substance abuse treatment. And for those people who cannot afford to pay $12,000 a month to go to a rehab facility, what are you going to do, right? You got nothing. You go to the hospital, you sober up in a few hours, and then you're back out on the street, you're out buying again, right? I want to talk about how important this is from my own personal experience. Alcoholism is a terrible sickness, and it requires getting a higher power, getting involved in a different sort of lifestyle. Growing up, I had 5 of my brothers who were alcoholics, and they solved their problem with depression with alcohol and ultimately suicide. 5 brothers that I experienced. I have a son who developed a gambling problem and is a schizophrenic. That was his only way of dealing with things, was eventually he took his life. So I understand how important it is to change not just what you do, but who you hang around with, because in this kind of environment, you're with people who want to see you succeed.
My role is Chief Juvenile Probation Officer, so working hand in hand with Shelley, and at the time a very small staff that she had on getting assessments done for juveniles, and also developing outpatient treatment services and resources to help identify kids.
I hope that we can all remember that as we do different projects and different initiatives, that it doesn't matter who you voted for, it doesn't matter who you like, doesn't matter. The real matter is the people that are being helped, and Shelley's doing that. So hats off to you and your staff.
So Living Free Health, the main number is 775-505-1625. And we're at Mesquite and Highway 160, 2 miles north of the Home Depot. The cafe is also at the same location. The hours for the cafe are Monday through Friday, 6:30 a.m. to 6:30 p.m., and Saturday and Sunday, 8 to 3. And we have some really great food, great value, and where do you get to eat and support addiction recovery?